So how can we prevent the spread of coronavirus? I thought it was time for a reminder. And actually the reason why I feel this way is because today, little story. I'm working from home these days. In fact, all of my colleagues in my practice are, because we're worried about coronavirus. So we're doing telemedicine from home. So we have our laptops and I'm seeing patients from home in my living room. And so I had a little lunch break before my next patient and I went out to go grab a sandwich from a place that's doing takeout. And as I was walking to get my sandwich, I was so excited about my sandwich. I noticed that people weren't really maintaining that 6-foot distance away from me when I was walking on the sidewalk. People were still walking right beside me or walking right behind me or right in front of me. And I was that woman being like, whoa, and I'd walk into the middle of the street to get away from someone, or I'd hold back or walk to the left or to the right. And it reminded me that this is a good time to remind us of all the things we can be doing to prevent and reduce spread of coronavirus, because that is some of the best of what we have to fight this virus. So as a reminder, let's first talk about this social distancing, right? Social distancing is the idea, guys, that we need to stay home. Oh, by the way, I didn't tell you who I am. Dr. Jen Caudle. If you guys, many of you know me, but if you don't, I'm doing daily coronavirus videos. So thank you for joining me. Anyway, back to social distancing. Okay. Social distancing is this idea that you want to stay home, okay? Unless you need some essentials like groceries or you need medications from the pharmacy or things like that. You really need to be staying inside, yes. And you also need to be staying away from other people if you have to go outside. That means 6 feet away from someone else. Now, by the way, that's the CDC recommendation. The World Health Organization recommends 3 feet, but here in the country of the US, we recommend 6 feet away from other people. If you're walking on the sidewalk, guys, don't walk right next to someone else. Move away, move out of the way. Get those 6 feet in there between you. That's super important. Also remember, guys, we talk about washing hands. I did a video on this. Wash your hands. Make sure that you're using soap and water. 20 seconds you need to be scrubbing. Super important, guys. And then if you don't have access to soap and water to wash your hands, you can then use hand sanitizer. Just make sure your hand sanitizer has at least 60% alcohol content in it. It's very important. Make sure that you are not touching your face, because this is how the virus gets in our body. It's spread by person-to-person contact and upper respiratory droplets. That's the stuff that comes out of our nose and our mouth when we sneeze or cough, okay? So if you get that stuff on your hand and you touch your face, your eyes, your mouth, your nose, you can get into your system. Or if it lands on your face because you're standing too close to someone, the same thing can happen. Super important. If you have to cough or sneeze, please cough or sneeze into your elbow. This is very important. Or into a tissue, then throw it away. Do not cough or sneeze into your hand where you can then just touch a doorknob. Just the big reminder of staying home, guys. I can't even tell you. Please don't go out if you don't need to be. And when you go out because you have to, make sure that you are staying 6 feet away from other people. Now, I need to say, because, coronavirus, things are changing day by day, minute by minute, second by second. So these recommendations may change, but this is what they are as of today. We know this is some of the best evidence to help us fight coronavirus. The other thing I would say is that many of you guys are from different countries all throughout the world, which I love. So make sure that you are following the guidance of your home country, okay? The recommendations I just mentioned to you are recommendations that we have here in the United States. Remember, this is what we can do to help reduce the spread and prevent coronavirus. So we're all in this together. We all have to do it. So guys, thanks so much for joining me. I'm Dr. Jen Caudle, and I'll see you tomorrow.